Morning, everyone. Thanks for jumping on this webinar. We might as well kick off and see there's plenty more people joining, but we might as well get underway. So thanks again for joining. And today we're joined by Talisha Reeve, a musculoskeletal podiatrist. She's also a SME subject matter expert working with the Gator Footwear team, who obviously is one of the main footwear brands that Badger sells across Australia. And we set up this webinar to share some learnings that she has from her clients. She has quite a wide client base in logistics, warehousing, and cold storage, which obviously we are servicing a lot of the same businesses across Australia. And so she's seen people coming through with foot injuries from logistics industry very regularly. And so she's got some very practical learnings to share with you. So today won't be too much theory, won't be hopefully too many big words, but you'll walk away with some knowledge that you can really apply in your day-to-day role, to making sure that we can be reducing injuries, reducing downtime, improving the productivity of our teams by giving them the right footwear. And hopefully by the end of today, when you pick up a pair of boots, you look at it a little bit differently. You'll know what to look for, to identify, is this boot going to work well? Is it going to keep my guys comfortable, reduce injuries, and make them happy at work? It's really the end goal of safety footwear. So without further ado, I'll hand over to Talisha, and I suppose just to call out, there is a Q&A box on this webinar, so feel free to put any questions in there. We'll hit them all at the end, and look forward to hearing what you've got for us, Talisha. Thank you.
Well, thank you, Dwayne. I'm very excited to be here and nerding out on footwear. That seems to be my wheelhouse. So just a little bit of an introduction to who I am and where I kind of fit into the space. So I am predominantly a musculoskeletal podiatrist. I've been in practice for almost 19 years now. And I've had a bit of a varied career. So I've also worked around COVID times in workers' compensation case management. So that was circa 2021. And with the workers' comp case management, I did, just because of my health practitioner background and especially my focus on lower limb musculoskeletal injuries, I ended up having a portfolio predominantly of lower limb MSK with workers' comp, and that went across like knee injuries, ACL tears, meniscus injuries, calf strains, ankle sprains, plantar heel pain, the full suite of it. But with my background so I'm not a researcher, I'm a clinician, but I very much use a lot of research to inform my practice. And with that background, I ended up sort of almost auditing, well, it was not almost, it was actually auditing a number of lower limb claims when I was working in workers' comp, just sort of seeing where there were probably gaps in treatment and what workplaces could do. And I was quite on board with a few of the exercise physiologists, the OTs, the physiotherapists that were doing a lot of worksite assessments and putting forward their recommendations for their injured workers to try and help them re-engage in work a little bit more effectively, more safely. And I also now lecture at the University of South Australia for third and fourth year podiatrists. And my area that I lecture in and the clinical supervision I do, it is in lower limb MSK. And footwear is one of my main areas of interest. So 3 weeks ago, I was in South Africa presenting at their national conference on footwear and the role of footwear in managing musculoskeletal injuries. So even though that talk was predominantly centered around running footwear, injuries are injuries, and footwear is actually a very powerful and useful treatment tool when we are dealing with a lot of injuries because of the different footwear characteristics that can help alter loads. And when we're looking at, say, running injuries, there's certain risk factors that can increase the risk of someone developing a running injury. But when we're looking at things in the occupational space as well, there are a number of really strongly identified risk factors that do exist. So what I'm hoping to do today is not bore you with stats and numbers and bits and pieces, but give you a little bit of an overview of how footwear can fit into both sort of the injury risk reduction element when we're talking about characteristics, but then if you are dealing with workers who do have injuries, how impactful footwear can be for managing those injuries. So I've got a couple of case examples that I've just dug up, not sharing specific patient information because of privacy, but giving you a little bit of an overview of what the barriers for these people engaging in work were and returning to work, and what footwear characteristics we actually leveraged to help them with that. So first up, the amount of occupational lower limb injuries that people sustain, I've highlighted here across manufacturing, transport, logistics, and wholesale trade, which is sort of the main demographic of those of you that are attending today. And like with running injuries, for many types of injuries, there's nothing specific that we can do to 100% prevent an injury occurring, but we can certainly reduce the risk of it occurring. So when people say, if you do this, it will prevent an injury, not really, but reducing the risk. And if you can reduce someone's risk, you can very much reduce the likelihood that they are going to sustain an injury. And if they do, we might be able to reduce how impactful it is as far as time lost from work. So a lot of the graphs that I'm just going to go through now, I don't know if many of you are familiar with this, but if on the Safe Work Australia site, they collate truckloads of data on different types of injuries, time lost from work, the cost of those injuries, and it's pretty staggering. So I'm based in South Australia, and I was working for Gallagher Bassett, and even the cost of return to work for South Australia, which isn't the most populous state by any stretch, it's hundreds of millions of dollars a year between time lost from work, that's the primary cost, but also medical expenses. And if we've got some really cost-effective and intelligent ways that we can approach that proactive approach to reducing injuries or hopefully improving the management of them, it stands to reason exponentially it can save costs and just make people's lives a little bit easier, both for employers and the injured workers. So if we have a little bit of a look at manufacturing, so there's different types of injuries that fall into different categories. So body stress is a pretty big global or umbrella term. So body stress can be like step count or the amount of times you're climbing up and down ladders, jumping out of trucks, any and everything. So it's just repetitive mechanical loads on the body. So if we're looking through at the manufacturing lens, musculoskeletal conditions make up almost 15% of time lost claims. And body stress, which is that repetitive loading, that makes up over a third of what is the primary contributing factor to those injuries. So when we have a look at body stress, that's again where footwear at times can fit into the injury risk reduction and the management strategies. And the stats are pretty similar if we're looking at transport, postal workers, warehousing, musculoskeletal conditions make up a very large portion of this as well. And again, body stress, over a third, is the primary contributing factor. Same with wholesale and trade. So the stat is actually the same. That I did triple check that, the musculoskeletal conditions sitting at 15.7%. But again, it's almost 40% of body stress being the primary factor for those injuries as well. And second to that, like with most of the other charts that we've just looked at, falls, trips, and slips. So footwear also has a pretty big impact on those mechanisms as well. If we think about the grip and the outsole and how that actually works with the surfaces that people are walking on. So on this, and again, any questions that you have, throw them in the chat and I'll address them at the end. But that's just giving you a broad overview of how prevalent musculoskeletal injuries are. And all of these musculoskeletal injuries, it's a blanket term. We can't go specific with the data that we can access on Safe Work for if it's upper limb, lower limb, foot, ankle. So bear in mind that sort of 15.7% and the 14% from the earlier graph, that doesn't just mean we're dealing with foot and lower limb. So just prefacing it with that, but it still does make up a large portion of it. So the common lower limb injuries that I treat when it comes to, because I'm back in doing a lot of clinical practice. So the common lower limb injuries that I see workers' comp patients come in with, but also when I was working as a case manager, these were some of the most common ones that we saw. And with these, I'll just give you a brief explanation of them. So knee injuries, this is where it might be a slip and a trip and we've damaged our meniscus, or we've had a pretty decent trip and fallen down and then our ACL goes. Calf strains, that's often where you've got a little bit of a tear in the calf muscle. So that's what a strain is. And most of the time when I see this, it tends to be our sort of mid-30-year-old males. And it tears at what we call the myotendinous junction. So it's basically where the calf muscle starts to turn into the Achilles tendon. And really simple mechanisms that contribute to that. It's like stepping down off a ladder or taking a big step up or jumping off something. Tendinopathies, that's a broad term. So tendinopathy basically means disease of a tendon. So it used to be called a lot of the times tendinitis, which means inflammation, but tendinopathy is the term that's more accurately used now in medicine because not all tendons are inflamed. But when we talk about tendinopathies, it can be the Achilles tendon, which is at the back, where it inserts into the calf muscle, into the heel bone. Sorry, I'm just looking for my foot. Not my actual foot. I've got a demo foot. Anyway, can't find it. And then the tibialis posterior tendon, you don't need a full anatomy lesson, but that's a pretty important tendon that runs down the inside of the ankle. And that's a very common one to get aggravated as well. And the peroneal tendon is a tendon on the outside part of your ankle. So a lot of people with high step counts, lots of walking, lots of time on feet, tendinopathies, they're the types of ones that people will experience. Tarsal tunnel syndrome, that's just a nerve that runs. So the tarsal tunnel is just the anatomical name for it, but it's a nerve problem. Plantar heel pain, you've probably heard of this before. People will call it plantar fasciitis, or it could be called plantar fasciopathy. Some people refer to it as heel spurs, which that's somewhat incorrect, but that's a story for another day. Ankle sprains, midfoot pain, that's a broad stroke. So midfoot pain can be midfoot arthritis. A Liz Frank injury is quite a specific type of injury. We've got a whole lot of joints. I really want to find my foot in. Oh, I've just found it. Hang on 2 seconds. It's on my other desk. Sorry. So the Liz Frank, that's just the name of these joints across the top of the midfoot here. Quite a common injury that we see is a lot of people lifting heavy things, dropping something heavy on it, and basically they can tear a number of the ligaments across the top here. So there's some of the really common workplace related midfoot injuries I see. And then we've got things called bursa and neuromas. So bursa are little fluid filled sacs that they kind of act like shock absorbers. They sit in between the heads of the what we call the metatarsal bones, but they sit in between here. So if we've got shoes that are too narrow, we basically get compression, and that can cause bursitis, or it can give you a neuroma. So neuroma is just a thickening of a nerve that can happen down through here. You've probably heard of it. It's a similar kind of mechanism to, you probably have dealt with a lot of injured workers with carpal tunnel syndrome. That's essentially compression of a nerve up in the wrist. A neuroma is not exactly the same, but a sort of similar mechanism down in the foot. Forefoot arthritis, front of like arthritis in the big toe joint or the toe joints, and then corns and callus. Corns are basically hyper focused areas of callus that occur in areas of pressure and friction. But we'll get into that a little bit later on when I'm going through some case examples for you. Now, when it comes to injuries, the cause can be very different for people. So this is where there's lots of different risk factors. So for any one injury, so if we're talking about plantar heel pain or plantar fasciitis, there's like 30 or 40 identified risk factors. So just because you have a risk factor doesn't mean that you're going to get it. It just increases the risk of plantar fasciopathy or heel pain roulette. So the more risk factors you have, the more or the higher the chance is that you'll get it. But when it comes to any injury that we're dealing with, if we're talking about musculoskeletal injuries, it literally boils down to the load capacity equation. So how much load is being applied to a tissue, and then what is the capacity of that tissue to tolerate that load? So this is where things like footwear and even your rubber flooring in if you're on hard surfaces, warehouses. That's where a lot of those interventions become really important, because if we are able to do anything to reduce an excess in load, that decreases someone's risk. So when we're looking at occupational injuries, there's some that we don't really have a huge amount of control of in the lens that we're looking through today. So like severe lower extremity trauma and fractures, which are our more severe bone breaks, they're usually sort of our accidents that are true accidents. Someone gets knocked with a forklift, or they fall off a ladder from a great height. So some of those more severe traumas, we don't really have a huge amount of control on through the lens that we're looking at. That's more sort of a OH&S or work health and safety lens. But when we're looking at some of the other factors that I've highlighted here, so arthritis, lower limb pain is kind of everything that I mentioned in those injuries just before, because with some of the research that we're looking at here, they look at lots and lots and lots of different people. And it's essentially if they have pain, injury, so it can be the heel pain, it can be the tendon pain, it can be whatever it is. So they just capture all of it. Knee injuries, and then our ankle foot injuries, like our ankle sprains and our specific ones, depending on the research paper. These actually make up a really big portion of lower limb injuries identified in occupational settings. So it's not always time lost from work. Some people will have their sick days, but then you can also have what they refer to as presenteeism. So it's essentially someone is at work, but they're not working as hard, or they're not able to be as productive as they want, which is a major cost because of the lost productivity that comes into it. And arthritis, very easily managed with exercise interventions, but also footwear. When it comes to knee injuries, these are ones, so there's some injuries that footwear can have a sort of risk reduction strategy applied to them, but then there's also some injuries, like knee injuries especially, that the footwear doesn't necessarily reduce the risk of the injury occurring, but after the fact, if someone is injured, it can play a pretty big role in how quickly someone can get back to work, which I will explain in a minute. So these are just a couple of little stats for you. So if we're talking about plantar heel pain, so that can be the plantar fascia that you can see in the picture here. Like I said, it used to be referred to like in tendon land as well, but plantar fasciitis. But now they call it plantar heel pain because it's not always inflamed. It can just be chronically degenerated or chronically stressed. And in an occupational setting, some of the biggest risk factors that they've identified to contribute to someone developing plantar heel pain: prolonged periods of time of standing, high step count, standing on hard surfaces. And interestingly, I found this out when I was actually working in workers' comp, was being a truck driver and the amount of time someone was getting in and out of a truck. So just that increase in load, often when they're jumping off the truck or off the lowest step onto the ground, that was actually a risk factor as well. And all of these risk factors that have been identified that can feed into someone's risk of developing heel pain can be modified with footwear. And so when we look at 25% of people who have had heel pain, 25% of them have had to take sick leave because of their heel pain. And on average, it led to 3 weeks off work. Major, major cost when it comes to loss in productivity and just the sick leave payments. And some people, up to a fifth or almost 20%, had to change their work assignments or work tasks or do modified duties because of their heel pain. So you can see how footwear, and I'm sure many of you, if you are doing the return to work coordinating or the injury management coordinating for your organizations, you've probably seen how impactful some of these injuries are when it comes to needing the modified duties, and just how difficult it can be to build someone's capacity up to get them back to work. And it's the same with just lower limb pain. And again, that's that sort of blanket term that people were using. And there's not a truckload of studies done in Australia specific to this, but when they were looking at the European Union with this big study that they did in 2017, collectively for all of the people that had general lower limb pain and had to take time off work, 270 million work days were lost each year when they were looking at that study. It's just phenomenal. And basically, the study that I've got here with the 25% of female, 14% of male hospital staff, even though not everyone here, or maybe not anyone here listening, is actually working in healthcare, working with nurses and doctors, those running around in the hospital settings, it's a very similar mechanism like we were talking about. Hard surfaces, lots of time on the feet, lots of steps. So even though the research stats here are from the paper looking at nurses and hospital staff, we can sort of take that mechanical load and apply it to the other people that we're dealing with in logistics. So when it comes to our occupational injuries, there's a lot of different physical exposures. So that's just the loads that the body is exposed to when we are doing certain tasks. And sometimes, like workplace surfaces, the use of tools, all of those things can feed into what equates to someone's physical exposure. But again, lens that we're looking at, weight bearing time on the feet. Now, I'm sure many of you who are listening have probably heard of the different types of musculoskeletal injuries that you can see in occupational spaces or like return to work spaces. So we've got our primary musculoskeletal injury. So primary is, that's the first injury. So directly caused by the work incident or the work accident or the work environment. So primary MSK injuries can be something like an ankle fracture that happened when someone fell off a ladder, plantar heel pain because they spend 10 hours on hard surfaces in their work boots, lower back pain, they were picking up the 15-kilo box and just doing it the wrong way. Now, that's the primary one. Those ones are quite easy, but many of you would have seen, and those of you that haven't, this is often what can happen. When we've got an injury, our body will often change how it moves to try and offload that injury. So you've tweaked your knee or tweaked your ankle, you walk a little bit wonky to try and not load that as much. It's sort of a protective mechanism that the body does to try and decrease the load on that side. But load doesn't vanish, it just moves. So if you're trying to change how you're walking to offload an ankle sprain or a knee injury, and you do that for long enough, you're going to start loading other tissues. And then this is where people can develop those secondary or consequential injuries. So these are ones like, we've got the example here that I mentioned. It's like knee pain that comes from the way that you've changed your walking. So that's again where footwear, and if we're looking at things through the podiatry lens, orthotics or those arch supports or inserts can become important as well, because they can sort of help with the load distribution and reduce how much someone is having to compensate and change how they're loading. And footwear through the podiatry lens is one of the most useful and powerful tools in how we can do that. Exercise therapies come into the equation as well, and that's where our sort of graduated return to work schedules and the progressive loading and the task and duty modifications come into play as well. So it's the combination of a few things, but again, today's footwear that we're looking at. So when it comes to some of the common injuries that we'll see that we're referring to, there's a few very common physical dominants that are in research strongly associated with certain injuries and certain injury risks. So I've got listing here, sorry, that's a typo. It should say lifting and carrying heavy loads. That is strongly associated with the development of knee and hip arthritis and also muscle and tendon injuries, because every extra bit of weight that we're carrying, our body has to absorb that as well. So if we're carrying an extra 10 kilos and we're walking, each step that we take, the foot, the Achilles tendon, all of those muscle and tendon complexes or structures, they're also having to work with that load. And you might carry an extra 10 kilos for 10 steps. That's 100 extra kilos that the tendons had to take. Then times that by maybe 10,000, 15,000 steps, it increases significantly. And I've got a little table that I'll show you later on where the math, you'd be surprised at how much it adds up for how much it's loading tissue. So talk about some of the characteristics that are important with footwear in a minute. So when it comes to prolonged periods of standing and walking, this can be warehouse workers, checkout staff, anything where you're spending prolonged periods of time standing on your feet, taking lots of steps. So those that are at Coles or Woolworths and they're packing shelves and they're lifting, lots of time on their feet, 8, 10, 12 hours, very, very strongly identified factor that can contribute to someone's injury. Awkward and tiring postures. So this is if you're having to bend and twist and get yourself in awkward positions. But again, tied in with that lifting and the carrying heavy loads is the high load carriage. So these are just different papers looking at different things, but overall, it literally all just equates to an increase in muscle and tendon stress, which becomes very important. It is related to our lower limb injuries. So we've got up to a quarter of people who work in warehouse and logistics have reported experiencing sorry, my chat's popping off, experiencing lower limb pain or back pain. And again, footwear, very important for mitigating that or managing that. And like I was saying, the cumulative effect, and this is where that primary and secondary musculoskeletal injury becomes really important, and also risk factors are important. You know how I said a couple of minutes ago that we may have 30 or 40 different risk factors that might play into someone developing a condition. If we've got modifiable factors, every risk factor that we can modify or reduce, that adds up to reducing the risk of someone actually sustaining that injury. So now we're switching a little bit into healthcare mode, just for a minute. So this is the clinical framework for the delivery of health services. So all of the statewide return to work organisations, so you've got Safe Work, Return to Work SA, this is the clinical framework that they've basically come up with, and they provide that to health practitioners, which essentially sets the expectation of what health practitioners do to manage injuries. So the 2 points that I've got highlighted here are the sort of ones that we can join the dots with. So clinicians are expected to implement return to work goals that are focused on optimizing the worker's function in the workplace and their ability to participate in their role at work and facilitate them returning to work, and basing their treatment interventions on the best available research and evidence. So when it comes to plantar heel pain, tendinopathies, all of those injuries that I listed right at the start, as a health practitioner, when we look at the clinical practice guidelines, all of the standards that are set out in what makes up the best method to approach someone's injury management, Achilles tendinopathy, plantar heel pain, ankle sprains, footwear is one of the factors that is in there, and it's listed up pretty high as the things that clinicians should be considering and addressing if we are managing someone with those injuries. So if the clinical framework for return to work and the delivery of health services is encouraging clinicians to rely on best available research, and the best available research is telling clinicians to pay attention to footwear. On the other side of the equation, when we are working in organisations and we're managing injured workers, footwear is also something that we need to focus on. But so many people don't. We just go, oh, a shoe's a shoe and a foot's a foot, and it's that. It's not until you've experienced foot pain and gone from a pretty terrible shoe into a decent shoe that you can actually feel like, oh shit, no, it actually does make a huge difference to comfort, to pain. And anyone who's listening, if you are a runner and you've had an injury and you've had to change your shoes, you'll 100% be able to relate. So what I'm going to do now, we're going to join the dots. So nerding out slightly. So when it comes to shoes, again, a shoe is a shoe, but there's multiple elements that make up a shoe. So we can split a shoe broadly into 3 elements. So we've got the upper, the midsole, and the outsole. So the upper is exactly what it sounds like, the upper part of the shoe. So everything up here, so where the laces are. And then the midsole on the picture here, that's that sort of greenish or the khaki color. The midsole is where a lot of those sort of shock absorbing properties and all of the kind of magical elements, well, not all of them, but many of the magical elements that us as clinicians use to alter someone's tissue loading, that happens in the midsole. And then the outsole is literally the interface between the shoe and the ground. So that's the grip, the tread, the harder rubber part that's contacting the ground. So different injuries are associated with different elements of a shoe. Okay, so if we're looking at the upper, we've got upper, like I said, the laces, that also is like how wide the toe box is, how deep the toe box is. So this influences the fit, so the overall volume. So how much of my foot can I fit into the shoe and how much can I fit it in there comfortably? Now, all three elements, they contribute to the mass or the weight of a shoe, which, as we'll talk about in a few minutes, is so, so, so important. Now, for those of you that may manage injured workers or you've been an injured worker, however it fits into the equation, different characteristics are related quite strongly to different injuries. So that's what the pictures are down here. So on the left, with that little highlighted part at the back of the ankle, that's where we're talking about Achilles tendinopathy, and that big word there, retrocalcaneal bursitis. Breaking that down, so retro means behind, calcaneal is the heel bone, bursitis, again, little shock absorbers. So basically at this point here, we've got this little cushioned area, and then we've got our Achilles tendon on top. So for some people, that can get quite inflamed. Now, if you've got a boot that's really hard down through the back here and there's not a lot of cushioning, that can irritate the hell out of a bursa or your Achilles tendon if it's a little bit irritated. So whilst there might be other treatment elements that come into play, we'll talk about that in a minute when we're talking about other elements of the shoes, but that's one element where the fit of a shoe is quite important, as far as having something that does have a little bit of cushioning, something that is contoured properly around the back of the heel. Because if you've got someone that they need to wear a specific shoe to do their job and they can't wear that shoe because it's irritating, then they can't get back to work. So that's one element. Now, the next one is ankle sprains and chronic ankle instability. So when it comes to ankle sprains, chronic ankle instability, so an ankle sprain is the acute event. So you roll your ankle, it hurts, you've damaged a ligament. And for any of you that have sprained your ankle, you know that it can be the gift that keeps on giving for weeks, months, or even years. Many people can develop what we call chronic ankle instability. So this is where they might take a step and like they step on a slightly uneven surface, they roll their ankle. Then they're not even doing anything, they roll their ankle. So it's just those repeated ankle sprains. So that's where the upper becomes quite important. So when you've got a shoe that you can sort of change different elements, so if you can make it nice and snug up around the ankle portion, that helps with stability. So many of you, if you've ever worn the elastic-sided work boots, they give over time, they can become quite sloppy. So if you've got someone that's wearing the elastic-sided boots, that can contribute to their re-injury risk. So having something that's secure at the up around the ankle, nice and firm, has laces, has other elements that we can make it nice and snug, that's actually quite important as far as a footwear characteristic for those injuries. Now, when we're talking about intermetatarsal bursitis or neuroma or corns, so that that's highlighted on the right here, that's got that little yellow bit running down in between the toes, that's a nerve. So we've got nerves that run down in between all of the bones through here. Now, what causes intermetatarsal bursitis or neuromas? It's essentially when the foot is getting squashed together. So if you've got an upper that is too narrow and too shallow, so shallow, we're talking about the depth here, and too narrow through here, that will squash the toes together. And then you get this chronic compression of those nerves and the bursa that sit in between. Now, these are two, and so are corns and calluses. So corns and callus is basically like where you get the extra dead skin. Your body puts that there to protect it if there's a lot of pressure, friction, and again, if the toes are getting squashed together and the toes are rubbing together a lot, that's where we can get those corns developing. So these three conditions or problems, bursitis, neuroma, and corns and callus, they are 100% something that width of a shoe and the depth of a shoe can almost eliminate the risk of someone experiencing those conditions. So what we're going to do now is just have a little bit of a talk about where the footwear applies to some injuries that I've dealt with. So this, so these are actually based on people that I've treated, and they're all occupational related. So this worker, 22-year-old female, works at a supermarket, won't say which one, but 8 and 9 hour shifts, working 5 days a week, standing at all times, and she wears a Garmin watch, so it tracks the steps, and she says she does upwards of 11,000 steps per day because packing shelves and just floating around. So 22 years old, she developed an interdigital corn. So if you see on the bottom right here, that's a corn. So if anyone's experienced one of them, it is phenomenal how 2 or 3 millimeters of extra skin between the toes can be absolutely excruciating. So she's only 22 years old. Corns, we normally associate these with people who are a little bit older, so 50, 60, 70, 80 years of age. They've got clawed toes, bunions, they're all stuck together. A 22-year-old shouldn't be getting corns. And when she was wearing every other shoe, when she wasn't at work, 100% okay. So it was purely her work boots. And after she'd been working for a few years at this supermarket, experiencing pain every shift, and it would kick in. Hi, David, I see you. Her pain would kick in after about 1 or 2 hours, and it would just get to the point that her foot was burning by the end of the shift. So she took a couple of days off work and then went, oh, I'll go see a podiatrist. So she popped in, and with the store boots, what I did here, because I didn't want to sort of share patient information because I couldn't get in touch with her, this is just an example of what I did. So basically, took the liner of her work boot out, took a trace of that, then got her to stand on that bit of paper as well, took a trace of that, and it was about 12 millimeters too narrow. So her foot was overhanging quite considerably from the liner. So her toes were just getting completely squashed together. So we debrided the corn. So basically you take the corn out and it literally just put a letter together, sent it through to her manager. She just needed a wider, deeper toe box, and since changed her safety shoes for work, no issue. So that's 3 days of work that she didn't need to lose. That's because I had to see her twice to do the debridement and then go through her footwear assessment. So even that in itself, like that's a few $100s for something that tiny problem that shouldn't have happened. So that's one thing. Footwear width is really important, and she would be like, she's probably the youngest person I've seen with, but I would say that over the 18, 19 years I've been practicing, between nurses, God, builders, construction workers, anyone that has to go into sort of safety shoes or specific work shoes, I would have seen at least 200 patients that have had this problem that could easily be addressed with footwear. It would have been more than that, but this is the directly associated to work. Okay, so having a look at midsole characteristics. So this is, like I said, so that's that little orange bit highlighted there, the part that was green. So there's a few different elements that we talk about with this. Now, a lot of these injuries, these are ones that footwear can slightly mitigate the risk, but if you've got someone with the injury, the footwear characteristics become a little bit more relevant after. So when we're talking about Achilles tendinopathy, tib-post tendinopathy, peroneal tendinopathy, and so on. So I'll give you some examples in a minute. We'll go through that. But with plantar heel pain, so that's the pain underneath the heel, what's often called plantar fasciitis, that really has an impact. And there's lots and lots of things that clinicians do that a number of footwear brands are doing as well. And that's one of the things I'm most excited about with the Gator shoes when I started doing the work with them for their insoles. So this example, male 45-year-old, warehouse and storage, 9-10 hour shifts. He was working 4 or 5 days a week, lots and lots of standing on hard surfaces and lots of walking on hard surfaces. And he had his heel pain off and on for 2 or 3 years. When he wasn't at work and he was kicking around on the weekends in his joggers, no issue. And he wasn't on his feet as much over the weekends anyway. So it was directly associated with the amount of time on his feet, the surfaces he was standing on, and the shoes. So the problem, lots of time standing on the hard surfaces. And so basically what was happening there is, just because he was spending so much time on there, just that constant sort of pressure up underneath the heel. So Initially, what he found was quite helpful. The picture here, that little blue patch, a gel heel cup. So he was just getting his stock standard work boots, throwing the gel heel cup in, and that was making life a lot more comfortable. And from a podiatry perspective, that's exactly what we would be recommending him to do anyway. And this is one of the things that with the gaiter shoes, I've got the picture up here, but where you see here that little red hexagon honeycomb pattern, this is essentially like a gel heel cup built into the liner that goes into the work boots. So I've actually, because I've been doing a few footwear wear testings and feedbacks, I've actually taken these liners and I've put them in a few of my other shoes now because they actually feel really good. So when it comes to reducing the risk of that plantar heel pain and looking at the stats earlier, where we've got up to a quarter of people that work in sort of warehouses, logistics, report experiencing heel pain, this is one element of a safety shoe that has, if we sort of extrapolate the research out, probably going to have a pretty decent impact on the comfort that someone has and potentially mitigating the risk of developing, or if they do develop it, can certainly help as far as treatment goes and getting them back to their sort of full-time hours sooner rather than later. And basically with the construction of these liners, that go into some of these work boots, it essentially mimics a lot of what we would do as a health practitioner anyway. So when we're talking about orthotics, they'll often be called like orthoses, orthotics, arch supports. But essentially, when you've got an arch support, the more contact that you've got with the liner of a shoe or the orthotic or the arch support, whatever you want to call it, the more contact it has with a person's foot, the more load is distributed. So instead of all the weight being under the heel and under the ball of the foot, there's more contact points that are taking the load, so it's distributing it better. So taking some of that stress off underneath the heel and shifting it more evenly throughout the arch. And then what you can see here in the bottom right, this is a design for a custom orthotic that many clinicians do. If you've got someone that's got that plantar heel pain or the pain underneath the heel, adding an extra bit of cushioning underneath there, that's one thing that clinicians do to manage this type of injury. So when I was working in workers' comp, the amount of patients I was going through and doing some of the audits, that this sort of like, even though I'm talking about one specific patient here, 45-year-old male, he's warehouse working, so many people coming through workers' comp had that. And you look at sort of their allied health management plans, the interventions that were being put in place, this was essentially stock standard. So if you've got the liner of a shoe that's already kind of doing that, injury risk mitigation or injury risk reduction. So now we're going to have a look at that through Achilles tendinopathy. So there's a different characteristic that we're talking about here. So this is a different worker, and I saw him probably 4 or 5 years ago, 37-year-old male, worked in a glass factory. He was doing some supervising. He did long shifts, but he was only doing 3 days a week, but still long periods of time on his feet. And he had his tendon problems off and on for upwards of 5 years. So what he was doing, when we've got the Achilles tendon, so the picture here, so if you picture like putting your calf muscle into stretch, so you get that nice stretch down through the calf muscle, what that's doing is putting a stretch down on the Achilles tendon as well. So if we're in shoes that have what we call a lower drop or offset, which I'll explain, I think the next slide. If we think going this way, that's putting stretch on the tendon, then we go this way, that's shortening the tendon. That's what we use heel lifts for. So a heel lift basically raises that up. That's one of the main treatments if we've got someone that's got Achilles tendinopathy. So this guy, he'd had, I think at that stage, like 3 or 4 cortisone injections, and there's only a certain number of cortisone injections you can have before it actually increases the risk of you tearing your tendon. So he had a lot of reduced range of movement or like tightness through the Achilles tendon. So his ankle was quite stiff. So because he had that decrease in flexibility, being in a shoe that was quite flat, that was really aggravating for him. So putting him in a lighter shoe that had a heel lift, that was actually very beneficial for him. So that's what this picture is. So visualizing it. So if we chock the heel up, that way it takes some of that tensile or that pulling stress off the Achilles tendon. That in itself was really helpful for him to get through more work hours without that discomfort in his Achilles tendon kicking in. So that was coupled. So we changed his work footwear, put a heel lift in, and then we were doing some rehab to just try and get the tendon a little bit happier and healthier. So that's what we'll talk about with heel offset, depending on what footwear brand that you're dealing with. Some brands will call it heel offset, some will call it pitch, some will call it drop, but it's essentially how high the back of the shoe is compared to the front of the shoe, and whatever the difference is, that's what your heel pitch is. So some shoes, if there's 0 drop, that means it's even, so there's no difference between forefoot, rear foot. Other ones, it might be a 10 mil drop, it might be a 5 mil drop, whatever it is. Now, the other thing here, where you can see, I mentioned the rocker. So the rocker is where the shoe kicks up a little bit. So you would have seen a lot of running shoes these days that they scoot way, way up really aggressively. Now, basically, when you've got a rocker, that decreases the load up through the calf muscle. So we don't need to go into a biomechanical lecture on that. But essentially, if we've got a little bit of a forefoot rocker, that just decreases the workload on those muscles and tendons as well, which can be quite beneficial to reducing that strain. So there's a lot of different characteristics that I'm talking about that you can hopefully see how they influence the loading of a tissue. And if we can influence or reduce the loading of a tissue, that's how people can get back to their normal jobs as quickly as possible. Now we're heading into the outsole. So with the outsole, there's not a truckload, because that's more the contact point, the slip protection. It can reduce the risk of someone's injury, but it doesn't have a huge impact as far as loading goes. But where it really, really influences it, it's the combination of what the material is made of at the outsole, the midsole, and the upper that equates to mass. So mass, this is where it becomes really important for us to consider footwear, because the combined mass of a shoe, if we times it by how long someone is on their feet, it actually adds up massively. And when we've got someone who needs to wear a safety shoe, but they're wearing like their mining boots and the boots that weigh like 1.5 kilos, walking for 5 minutes might not feel like a lot, but it adds up to a lot over time. So essentially, this was one patient that I was dealing with. He was just very, very slow with his recovery because he'd tripped and fallen, slipped, hurt his meniscus, and his main barrier was he could only get up to a couple of hours of work before his legs were just really, really tired. Because when you have meniscus tears, ACLs, ankle sprains, basically what it does, we get muscle weakness, and it takes a fair bit of time for that muscle weakness to catch up. So if we're adding in shoes that are excessive in weight, muscle fatigue kicks in quicker, which essentially, if we're getting more tired in the legs, we're limited with how long someone can work. So if we've got a 600-gram shoe for 12,000 steps, that equates to 7,200 kilos per foot if someone's doing 12,000 steps that day. But then if you compare it to a 1,500-gram or 1.5 kilo safety boot, 18,000 kilos per foot for a workday. So that's where weight becomes really, really important when we're looking at that sort of return to work and the muscle fatigue element, because it adds up over time. So if you've got an injury, your body's already stressed, and then essentially the shoe is adding extra stress, it can just take a significantly longer amount of time for a person's capacity, if they're doing rehab exercises, to build them back up. So if you can literally eliminate 30, 40, 50% of the weight of a shoe, that has a huge impact for the muscle fatigue and soreness. And even just in general, if we're thinking about things from a comfort point of view and just how comfortable it is being on your feet for so long, dropping the weight of a shoe, if someone doesn't need to be in a complete wheel chock of a shoe into something that still meets all the safety characteristics, but it's a lot lighter, huge impact when it comes to comfort and everything. So long story short, footwear has a huge role in what we can do for injury risk mitigation. and proper fit, design, weight characteristics that are suited to the worker or the person. Very, very impactful. So this slide here, I'm not going to read it out for you. This is more for your reference later on if I've just thrown too much information at you. So if we're dealing with certain injuries, what type of characteristics are really important to consider in a shoe? So these are basically, like I said, this table, more so for your reference after the fact, if you want to review and go back to it. So I would like to thank everyone for your time and attention for this. So if you have any questions that you want to throw at me, I am more than happy to answer that.
Yeah, awesome. We've had a few good ones come through. I can read them out if you want.
Yeah,
So
sure.
the first one's about what do you see the most common types of injuries coming through from clients in logistics, warehousing, supermarkets, truck drivers? Probably touched on it a bit, but don't just reinforce what the most common ones you get coming through.
Yeah, so this is speaking through my experience, podiatry, lower limb, MSK. So most common ones, plantar heel pain, definitely. So it's just sort of plantar fasciitis or that sort of heel spur characteristic. That would probably be the most common. And it's just that prolonged periods of standing, hard surfaces, heavy boots. And then the other one, like I'd say this year and last year, probably most common, it was sort of those interdigital, so in between the toes, like your corns and callus. So that's a footwear upper element. So heel pain would 100% any day of the week be the most common. And then our sort of squash toe together injuries would be second to that, I'd say.
That's good. And then there's a couple of questions from Laurel relating to the upper. We can probably tack them together. So firstly, any suggestions on how to identify the, the depth of the boot for forefoot comfort? And then in the example about the heel lift, did that require a new shoe with a deeper upper to make that heel lift work and help the tendon issues?
You might have to, so first one, depth. It's more or less, you can sort of, if you can splay your toes and lift, so if you're in a shoe, if you can feel like you can lift your toes up, sort of, okay, so say you're barefoot, feet on the ground, lifting your toes up as much as you can. You want to be able to lift the toes up as much as humanly possible in the shoe as well. Like you won't get them all the way up like this, but if you're barefoot, you can lift it up this much, and you're in a shoe and you can only get that much before you're tapping the top. That's probably a little bit too narrow, because if we think about how much the toes will sort of flex up just when we're walking and taking steps. So if you've got a little bit more move, so it feels like you can get a nice little spread up of the toes, it's probably the best. So you lift up, and if it hits very soon after, and even just because you can't sort of do the toe push down test if you're in safety boots because you've got the composite cap or the steel cap. But yeah, getting the person to lift up and how much does it feel like they can move their toes in the shoe? That's probably the easiest way to do that.
It's
Oh,
good.
and
And
the
then the
heel
next
lift.
one was about the heel lift. Yeah. Do they need new
Yeah.
shoes?
This fellow, he didn't, because he was in like sort of your more high ankle boot. So if you're in a shoe that's a little bit lower, depending on the type of shoe and how deep the heel collar is or how deep it is around the heel, there are some shoes that people do need to change because you put the heel lift in and they slip out. But this fella in particular, he didn't, because he was in a boot like this. So inside a shoe, you can go up sort of 10, 15 mil with a heel lift before you actually start to have fitting issues. Yeah, so for him, he had a 6 mil heel lift, so he absorbed it into his shoe quite fine. But again, it just depends on how much you want to offload it. But that's why paying attention to the characteristics of a shoe. So if you've got like a work boot and you know that this is 20 mil, that's 10 mil. I'm just inventing those numbers for easy math. But say there's a 10 mil offset and they've gone from a shoe that might have a 5 mil offset, you've already, because of the outsole and the midsole, you've given them 5 mil. So you don't have to correct as much in the shoe because the outside part of the shoe is doing it.
Yeah. So you can actually choose a shoe that's got more offset from the get go and you don't even need a heel lift potentially.
Yep, 100%.
Awesome. That's good. Question here about how does the individual's weight affect the load versus the footwear weight load itself?
Um, Footwear versus body weight. So when we look at injury, so say we're talking about plantar heel pain and tendinopathy, all of that, with a lot of the studies that they've done, body mass is its own sort of small risk factor. But when they've looked at like big populations that have, high body mass, low body mass, it makes up for some people, it's about sort of 30% where the research lands on body mass versus a lot of other factors, because you can have someone that's got high body mass, no problem. You can have someone else that's got high body mass and it is a problem. So when they've done big studies looking at lots of different populations, and you'll always have one or two patients that the body mass might be 100% for them, but then you might have someone that's got high body mass and it's not hugely a problem. On average, they've landed it makes up about 30%, but footwear, the surfaces that they're standing on, the amount of time that they're on their feet, they land at sort of on average being sort of more predictive factors, and they're easier to modify. So getting someone to lose 80 kilos or 50 kilos or 20 kilos versus having a shoe that's got a little bit more cushioning versus throwing some rubber mats on the floor. Yeah, it's a lot easier to change shoes than change the entire lifestyle and dietary habits of someone to get them to lose 20 or 30 kilos.
That's good. Thank you. And a question about from Christian about what are the best work boots for people with overpronation?
There's so there isn't really one. So if we're looking at pronation in itself, again, with all of those injury elements, pronation on its own isn't really a risk factor for someone developing an injury. So it becomes relevant if someone has developed something. So if we're talking about heel pain or like the tibialis posterior problem, so that tendon that runs on the inside of the ankle, for so many people, and they've looked at literally tens of thousands of people, that pronation, not a risk factor for developing a problem. But if you have developed it, then it becomes relevant. Now, most work boots, they're different to running shoes. So there are some running shoes that they have different sort of motion control features within them. Most work boots don't have that because they're not sort of the key things that we need to worry about. Because with work boots, it's the safety characteristics that are more important. And with that, sort of the more important thing is if you've got someone that maybe has a sort of pronation aggravate or an injury that's aggravated by their pronation when they're in a shoe, probably what's more important is having just a shoe that's got enough volume, so space inside the shoe, that you may be able to take the liner out to get an orthotic device in there. So I know that's a lot of words to answer the question, but it's just painting you a little bit of context as to why there's not really one best shoe.
Yeah, that's good. And obviously, just finding a shoe that you can remove the insole is a great first step because a lot of them these days you can do that. It's good. Thanks for the question, Christian. We've got a fair few coming through, and not probably a lot of time, so maybe let's just do one more. And
I'm happy to answer, like, if people are happy to stay on for another couple of minutes, like, I don't have any issue answering. That's fine.
cool. And we can probably also actually do an email around after as well. There's a question about if how can a person figure out what's causing their foot pain so they can address it properly, apart from go to a good podiatrist. Or maybe
Oh,
that is this thing.
that would be what you need to do, because it's essentially, yeah, like Dr. Google will sort of bring you unstuck any day of the week. Because if we're talking, I was in Melbourne over the weekend running a workshop on plantar heel pain, and that's why they call it plantar heel pain now, because it's not just the plantar fascia. You've got so many different nerves, connective tissue structures, muscles, tendons. So you might have pain in one area, but it could be 10 or 15 different structures. So literally the best thing that you can do to assess and manage something, or effectively manage something, is see someone that will actually arrive at a correct diagnosis, because once you know what you're dealing with, then you can sort of extrapolate it out and go, okay, well, I've got this nerve problem. That means I will likely need X, Y, Z to address that. I've got this plantar fascia problem. I need X, Y, Z. So it's seeing someone to get you the right diagnosis, because, yeah, other than that, Google's just going to help you kind of, you're shooting in the dark, really.
That's good. Thank you. Let's do one more. So you've spoken about three key areas of the shoe: the outsole, the midsole, the upper. When you are looking at a shoe as a podiatrist, are there any other things that you look at or squeeze or bend to identify if it's going to be comfortable and a good fit?
You go off, many people, if you're on social media, you would have seen that, where people, they get a running shoe and they'll squeeze the heel and go, it shouldn't squeeze, and then it shouldn't twist. But it depends on the purpose of the shoe. So if you've got someone that they want to do CrossFit, jump around in the gym, you actually want a shoe that you can be quite flexible in. So it's matching the shoe with the purpose. So in this context, it's the safety characteristics. Does it meet that? Yes. And then essentially, if there's certain jobs that they're doing, does the shoe have the characteristics for that? Which is what we spent a lot of time going through today. So if we've got heel pain, the sort of cushioning elements and the midsole. If you've got someone that they're up and down ladders quite a lot, they're jumping and landing on hard surfaces, again, like the cushioning characteristics within the midsole. So there's not kind of one best thing. And when it comes to comfort, a patient's or a client or a worker's individual reports of it, like, do you feel any hot spots or pressure areas? Can you wiggle your toes? Is there enough room, like volume wise? Like, does it basically, it's hot spots, and does it feel comfortable for the person? So if you've got the characteristics, tick, 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 and then patient perceived comfort. And that's even where the research lands at, because there's no one shoe for runners that's going to eliminate or reduce the risk of someone's injury. The best bet is matching the type of shoe to the type of running that they want to do, trail running, road running, whatever it is. And then does it feel comfortable for them? That's pretty well it.
That was awesome. And obviously, the Badger team can actually help with this sort of thing as well. If you want to look at a range for your team, we've got a bit of a checklist. You can involve Talisha and have a good look at it for your team specifically and what your guys are actually doing. Um, so we might wrap up there. Thanks very much for everyone's attention and the awesome presentation and content, Talisha. Very helpful. And we are going to obviously send out a recording if there's stuff you want to go back to, and also turn slide content into an ebook so that you can keep that on file, share it with your team, and hopefully have a good look at the footwear your team's using. Are you getting the best return on it? Is it fit for purpose, or would you like to do a bit of a deep dive or even an audit on your current range? That Talisha can get involved with the Badger team. We look forward to hearing from you. Thanks again very much for jumping on, and have a good day.
Thanks, everyone. Thanks, Dwayne.